Diksha will live. Diksha, please let's go ahead. You're live.
Hello. Hello.
Yes, Diksha will live.
Hi. Hi everyone. Welcome to the session. I'm Isha. I'm part of Indian team at West India, and I would like to thank all of you for joining for the session on how these are combating the COVID-19 crisis. So, how have the essential services like delivery of medicines and pharmaceutical products continued uninterrupted through the nationwide lockdown in the country? And what are the e-pharmacies doing to uh, uh, meet the surging demand of masks and sanitizers? Or how are they keeping their frontline delivery staff pace? These are some of the most relevant questions in the face of biggest health crisis in recent times. And that is why today we have with us Mr. Gaurav Agrawal, co-founder 1MG, Mr. Dharmil Sheth, co-founder of PharmEasy, and Mr. Joy Pandekar, founding partner at Udan.com, who would help us in understanding how are these e-pharmacies, which have been around in the country for over 3 years now, combating the COVID-19 crisis. So, Gaurav, my first question will be to you. So, the online medical stores, which have been struggling to take off in a big way, mainly due to the regulatory issues, have seen a surge in demand and sales across the country during the COVID-19 crisis. Had you anticipated this demand coming your way?
I'll just interrupt. Diksha, you're breaking. Your voice is cracking. So, is it with me only, or I think everyone is facing the same problem?
Hello? Am I audible now?
It's with everyone actually.
Diksha, your voice was cracking.
Let me just try again. Hello.
Yeah. In the meanwhile, I got the question. I hope you guys can hear me fine. First of all, thank you for having me on this webinar. So thank you for the invitation. I think the first thing to clear is that actually the e-pharmacies, if you will, have actually already taken off in a fairly big way. There are, of course, some regulatory hurdles that need to be cleared in terms of some clarity, etc., that needs to be provided. But from that standpoint, from a regulatory standpoint, there's actually no pertinent issues. And the e-pharmacies have already taken on in a very, very big way. Today, for a lot of the folks, and increasingly so in the metros and even in the real power tier 2, tier 3, e-pharmacies are a staple way of actually getting medicine, especially for chronic patients where availability, offline bounce rate, quality of medicines, authenticity is actually a huge concern. So first is I just wanted to clarify this misconception that e-pharmacies haven't taken off and they were dependent on COVID to take off. They were already actually becoming just like e-commerce, they've already become a fairly standard part of life. Between PharmEasy and 1MG, both Dharmil and I, and here, we actually cater to millions of consumers every year, growing over 100% year on year. And that's actually a hallmark of a very, very bustling ecosystem. What COVID did, however, was actually it increased the rate of growth for this already fairly fast-growing sector tremendously, because what happened was that, look, every online ecosystem depends on some number of people trying your services out, right? There are some who are early adopters of those services. There are some who are late adopters. And what COVID did was the lockdown actually forced everyone to become an early adopter because of the lockdown, the pharmacies were shut down, people were not allowed to go out. And the only option that folks had was to actually go online and try and get their medicines online. And that was what the effect of COVID was, and that was hugely positive. We were starting to get a sense of what this demand could be because, as the government was starting to talk about lockdowns, etc., we were getting geared up that there will be a surge in demand. The extent of the surge is something that I don't think, at least I don't think anybody could have anticipated. And what it has led to is that without any marketing, without any spends, ad spends, etc., the platform's just been self-sustaining, growing rapidly month on month, and that's been very, very heartening to see. So that's the impact of COVID.
Okay, so Dharmil, building on this question, had you anticipated this sort of surge in demand, and if you did, were you adequately prepared to meet the demand?
Actually, it's still pretty hard to hear you. I think your internet connection has some issues.
Yeah, so
let me just check again.
I'll just answer that. Got the question. I think agree with what Gaurav said. We never anticipated such demand on the platform, but at least what positives we saw that there's a huge behavioral change on the consumer front. People who were still on the fence for adapting online channel as a purchase have now started transacting. Everything was positive for us except for the fact that because of the lockdown, there were some disruptions on the supply chain. Because we are also dependent on retailers and distributors and pharma companies. I think the logistics were not able to meet the kind of surge in demand that we saw. And hence there were some disruptions, but net, I think all of us saw a good surge in demand and a lot of new customers now transacting on the platform than before. So I think it's just a validation of the kind of model that we have in place where it's a win-win for consumers for getting all their medicines available, accessible in an affordable way. A win-win for consumers, retailers, and for platforms like ours.
Sure. Just want to check if I'm audible now.
No.
Or is there still problem? I think there's some issue with the Wi-Fi. So is it just not audible at all?
Your voice is breaking. I think we can figure out what you're saying.
Okay. So Joy, my next question is to you. The ongoing crisis has presented the e-pharmacy sector with both opportunities and challenges. So as a B2B trade platform, what are the challenges that you posed post the announcement of lockdown? And what are the opportunities that you could leverage and in terms of the pharmacy sector domain of your platform?
Historically, whenever there is a challenge, always the younger companies, which are disruptors generally, they benefit in some way or the other. For example, if you have seen during demonetization, Paytm numbers just surged, right? And other e-wallet companies. So similarly with us also, we benefited a lot in terms of, as Gaurav and Dharmil have said before, that the demand surge was there. And that happened on two counts. We do only B2B, but for us, what had happened was a lot of the wholesalers, distributors were shut. And that's where a lot of the retailers, the chemist shops, they depended on us for their supply. So in fact, our average order size also increased quite substantially. So we benefited a lot on that. And we see a similar, the growth, Dharmil and Gaurav may know better, but our growth in the medicine industry would be the same as pre-COVID because the demand would be primarily the same. It's only that the tier 2, tier 3 cities where folks don't want to come to the major cities and for their medicines or for consultation or any other stuff. So those are the guys who are going to depend on the chemists, and that's where we would be able to see some growth for us. Hello. So let me continue for some more time then. She's back. So the other thing is that, yeah, as what Gaurav Dharmil had said, that the supply chain, because the chemist, pharmaceutical companies had distribution challenges and all of that stuff. So we faced the same too. That was a slight drawback, but primarily that happened because of the supply chain logistics getting disrupted, workers not in place in the pharmaceutical companies. So those were the challenges by and large that we faced. But it was overall a good, I mean, I'm not to be happy about the COVID, but yeah, for business, it was slightly better for us. I think Dharmil Gaurav can add something till she's back.
Yeah, Isha is locked out right now. She's experiencing some network issues. Meanwhile, I'll just, the next question we wanted to pose to Gaurav, to you. What do you think? Which sectors are facing a financial crunch at this time? A lot of employees are being fired and salaries are being deducted. What do you see the situation is like in the online pharmacy industry?
Yeah, look, I think everyone is affected. Every business is affected, and every business is affected in different ways. So, while, and I'm not speaking on behalf of Dharmal, but I think he will agree that, while there are parts of our business which are doing really well, there are challenges in those parts as well. He highlighted how supply chain is an issue. The cost of fulfillment, for instance, has gone up. There are now some positives, some negatives to working from home, etc. So while there are obviously sectors like travel, airline, transportation, etc., which are probably just negatively affected, and we are much more fortunate that healthcare is sort of like an evergreen sector, and given that this is a health emergency, we've seen a reasonably massive surge in demand. A lot of people are trying our services out. That said, there are challenges. There have been challenges in our sector as well. We're all venture-funded companies, so there are challenges around that because the financial markets have sort of been under a lot of stress lately. And it's all a ripple down. The whole economy is connected. If people get laid off, don't earn, then every consumption gets affected, whether it is their medicines, whether it is their food, etc. Now, given that there's a surge in demand, so I'll give you some examples. When the lockdown happened, a lot of our retailers, etc., depend on migrant labor or people who come from remote areas to actually do fulfillment, etc. And all of this manpower disappeared overnight, right? Because there was a lot of fear in the ecosystem, and they are not coming back. So this created issues for us to try and deal with that situation. Some of it has been dealt with. I think things are easier today now that the movements have been enabled, etc. So we are hiring. We are hiring to meet the extra demand in the warehouses, to meet the extra demand in the fulfillment centers or the delivery guys, etc. In the retail, we are helping our retail partners hire. Our retail partners get access to credit, etc. in these times. So we are trying to help the whole ecosystem as much as we can. And that's been positive, but there are a lot of challenges still on the ground as well.
Yeah, I'll take that question. So the growth, I personally feel in the B2B space, we will not see a huge surge that we had seen during the COVID times for the wholesale piece per se. The surge we saw was primarily, see, generally there's a breakup of 60-40. 60 would be approximately the chronic patients who buy things like blood pressure, diabetes, and all that stuff, and which they require on a timely basis. So they cannot do without it for 2-3 days and stuff like that. So they had ordered much in advance. And since they were ordering, there was a pertinent demand, and so the chemist had stocked it. And that's where we are seeing that surge. Now, going forward, that demand to grow may help 1mg and pharmacy, because people would shift from offline to online, right? And especially because of the scare of people, elderly people going out to buy stuff, or their children going out just across the road and buying, they would prefer to do this. Now, and also because these chronic medicines are primarily the prescription medicines, so it wouldn't be a problem for the online space to cater to them. But and I think it's a huge opportunity for Gaurav and Dharmil to capitalize on, and I always say that, we should always capitalize on challenges or crisis. Yeah, I'm done.
Yeah, so I think e-pharmacy per se is not just a consumer platform, but our process also covers parts of the retail operations as well. How quickly are the retailers able to process the orders, whether they have the required inventory or not, where can they procure inventory from. So it's not a change in consumer behavior. It's not just a change in consumer behavior, but it's an overall supply chain behavioral change that we are looking at. So it's extremely helpful if the supply chain gets much more efficient. What online platforms will be able to do is predict and forecast the demand beforehand. It will help the pharma companies to plan better. It will help pharma companies to distribute their goods better. It will understand where are the extra stocks lying around the country, where is demand coming from, what brand is required in what state, what city, what pin code, this level of clarity. If you look at a traditional channel versus an online channel, I think the pharma products get expired. Going back to the manufacturer, the number traditionally is anywhere between 3 to 4 to 5%. For online platforms, it's anywhere between 0.5 to max of 1.5%. That's a big relief for pharma companies. Also, we can make the working capital or make the retailer very efficient on working capital. So that's one of the reasons where just an example for how it's not only critical for customers but also for supply chain partners as well. I think I missed the second. Sorry, what was that?
Dharmil, the second question was, what are you doing to make sure that you can service rural customers as well?
Right. Correct. So there are close to 500 to 700 districts in the country, and we are in process to partner with as many retailers as possible. In fact, we keep getting a lot of requests to have fulfillment partners in smaller towns, cities, talukas. So we are trying to expand our reach as much as possible. But nonetheless, even today, using logistics partners like Express Bees, Delivery, India Post, we do reach to each and every pin code of the country. And as we keep going deeper in the country, we've seen there is a lot of demand, not because people want to have convenience and home delivery, but more because medicines are not available there. So that's one of the key reasons where why the demand comes in. And we are already reaching out to these customers. Again, it takes some time to reach them today. But as we keep growing our fulfillment centers and partners across the country, the turnaround time will keep improving and the experience will keep improving.
Well, and I'm sorry for the inconvenience caused because of the Wi-Fi. So Gaurav, the next question is for you. E-pharmacies have seemed to have a conflict with the brick and mortar pharmacies. Is that true? And do you plan to collaborate with them in near future?
Couldn't understand.
Gaurav,
The question
was
she
I
was
audible?
asking, the question she's asking is, there has been a slight friction between the online and offline
Yeah,
chemists, and would you want to partner with them in the future?
yeah. Gaurav, you're on mute.
No, so we actually partner very, very extensively with brick and mortar pharmacies. In fact, for all the sectors that Dharma has already talked about, like rural, etc., brick and mortar pharmacies are absolutely critical, right? Because when a person wants their medicines, they want to make sure that everything that they order is available and that the order is delivered as quickly as possible. And what brick and mortar pharmacies offer is they offer this massive network, right, which we can tap into and we can make medicines available wherever the consumer is. So they're absolutely critical from our supply chain and offering perspective. 1MG already partners with hundreds of brick and mortar pharmacies across the country to enable medicines. Now, when we talk about conflict of interest, this is just some amount of narrative created by some vested interest in the ecosystem. Look, the question that we have to ask is retail consolidation going to happen or not, right? Are we going to be small stores? Are we going to enable large stores to come up or not? The problem is immaterial whether it is online or offline, right? And we think that of all the online uh, commerce that exists, right, e-pharmacies are probably the most friendly because we enable offline pharmacies to become technologically enabled. We enable them to sell and get demand from a much larger base than the immediate locality that they serve. We provide them with all the infrastructure to actually service this demand and grow their business. We get them access to credit. I know Udan, for instance, does a ton of work there in terms of access to credit. So from that standpoint, there's no conflict. We are very symbiotic in that ways, and all this notion of conflict is just created by a false narrative. Dharmal, Joy, anything you guys want to add there?
Yeah, I
On a
think
lighter note, I'll say, sorry, on a lighter note, I'll say to Diksha's question whether there's a conflict and whether they'll partner. I think online e-commerce firms are like uh, national parties, and the local stores are the regional parties. And somewhere or the other, they have to cohabit and live together, and that's what is happening. But on the fair side, see, also what would happen is the online e-commerce companies would help the offline guys when they partner in terms of inventory management, their working capital, and that would also give a huge amount of data by which the pharmaceutical companies could then plan their manufacturing accordingly.
so. As on date, as we speak, there are hundreds of partners on the platform for all of us, and these guys are a part of the brick and mortar pharmacy network. So obviously, there is the association and all of these. It's become like a political sort of matter for them. But anyways, a small retailer in your neighborhood, all they care about is whether they are getting demand and whether they are getting net profits out of their business. And after working with us, a lot of these guys are making a lot of benefits. So we don't see any issue working alongside and If you look at US, even after what Amazon has scaled to, the share of the industry is probably 5 to 7%, 8% for Amazon, and sorry, for the online space, and the rest is still offline. So obviously these two channels will coexist. It's just about what is the consumer preference. There will be enough consumers for both the channels to scale and exist as well. Yeah.
Got it. Uh, what we now want to understand is how are you managing your supply chain logistic with very limited interstate mobility that existed? And are there any special provisions to assist e-pharmacies in their operations?
I think we were pleasantly surprised with the way government has collaborated since the start. As soon as the lockdown was announced, I think there was a working committee or steering committee which was helping not just online pharmacies, but all other e-commerce companies as well, to ensure that their supply chain is not disrupted. And we were given the required support to get permissions for movement across the city. Interstate and intrastate movement was a problem due to district level restrictions. But again, after the first lockdown, all of that started improving a lot. And at least from our side, what we started doing was obviously the manpower went down by almost half in the first lockdown. But then we started increasing the manpower post that, and kept increasing that number till we stabilized on operations. And obviously the cost of operations have improved because of a lot of hygiene and sanitization precautions that we have to take for all our delivery boys, for all our retail partners, distribution partners. Everyone needs to have gloves. Everyone needs to be, given a sanitizer. Everyone needs to have a mask. Everyone needs to maintain social distancing, even while they are operating inside fulfillment centers. So all of that obviously increased the cost of operations, but we've done that nonetheless, so that the customers keep getting what is needed without any disruption.
Got it. Joy, I think we have a similar question for you. How are you managing your supply chain, ensuring adequate stock? And what operational changes have you made to manage during those crises?
See, we've not faced any challenges, to be honest, in terms of interstate movement and stuff like that, because as Dharmil said, the government really rose up to the occasion and a lot of coordination has happened. Yes, of course, in the first week, because everyone was taken by a storm and challenges which each sector would face were different to a bit. So initially, first a week or so, there was slight challenges, but then after that, slowly it started easing out. And we didn't have to do much of a change other than working with less manpower, and we had to do more with less, so we didn't have to do much of it. And for especially our medicine business didn't get affected at all. In fact, it saw growth.
Gaurav, would you want to add something on that?
You're on mute, Gaurav.
Sorry, on the supply chain disruption, no, I think Dharmil and Joy have covered everything. I think I would just like to reiterate, we've all been probably pleasantly surprised, but the government has done a fabulous job of working with all the stakeholders. They've been very proactive. If we faced any challenges, they were sorted in most cases within 24 hours. Most of us had very, very high level access into the local administration as well. And I think all of those things, there were challenges, there were teething issues, but those got resolved very, very quickly. And I think that pulling the lockdown at this scale was not easy, and I think the government did a really good job at ensuring zero disruption or very minimal disruption, I would say.
Thank you. So, Gaurav, my question again for you. Given that the challenge posed by virus seems to be long term, how are you planning your next 6 months to a year, and are you looking for some specific collaborations?
Yeah, look, that's a tough question because it's almost like gazing into the crystal ball and trying to answer. So, one of the things is that I think a lot of the initial euphoria or hope seems to have gone away. We had hoped that the virus will either be very contained in the country or will go away quickly. I think with the rising cases, etc., there's a realization that's coming in that it's here to stay. I think the lockdown, etc., have also pointed out that a lot of the ways in which we did business was inefficient. So, to give you an example, working from offices seems to be extremely inefficient because our team has been working from home for the last 3 months, and we are extremely efficient. We seem to get a lot more done. Everyone that I've talked to has said that, hey, I don't need to worry about X, Y, and Z. I don't need to take long breaks. I can actually do a lot more done. I can even work out. I can take care of myself. And things are a lot easier. So I think that's the first change that's happening on what we are changing in terms of how we are doing things. I think the second thing that's happening is there are new opportunities coming up, right? So telemedicine, for instance, is an opportunity. I think a lot of changes are happening on the pharmaceutical side on how the pharmaceutical industry conducts its business, for instance. So those are new opportunities cropping up. I think COVID testing is an opportunity that's cropping up. I think if the virus is, let's say, to stay in the system for 6 months, and corporations and hotels and restaurants are to open, then that safety, health, and hygiene is a new opportunity opening up right now. Because of 1mg and because we cover the whole spectrum of healthcare, from pharmacy, diagnostics to consultations, we are actually able to think of a lot of new products which are relevant in this area, and those are the areas where we are working on, right? And we are quickly, in every few weeks, we are launching new products that basically bundle our services together. So today, for instance, we are doing a lot of enabling a lot of COVID testing, both for public and private enterprises, where sample collection is an issue. Similarly, we're doing some work on quarantine, etc., and enabling both public and private enterprises to help. So those are the areas that we are working in, and we are continuously collaborating with new companies and individuals.
I think this is really amazing what you've been doing and how you've been deviating within the business model. So, Dharmil, we understand that e-pharmacies can store and analyze large amount of data on consumers across the nation, which can also be very useful for planning public health policies. What are your thoughts on this?
Mike is muted, Dharmil.
Yeah, I think digitization of healthcare data can help every stakeholder, be it the patient, the doctor, supply chain stakeholders, fulfillment partners, or the government itself. I think India has less than 7% of individuals who are covered under insurances, and I think plans that government are launching for the benefit of people are still not able to cover the right set of people at the right prices. You don't know whether an individual actually has diabetes. Is it a pre-diabetic patient, or has already got infected with the disease? A lot of it is still happening. It's a post verification process that people follow. What happens in a digital ecosystem is all the data points are captured against an individual. So the way our financial data is tagged to a PAN card number, I think we definitely need a health ID or our healthcare stats tagged against an individual's social ID in the country. That'll absolutely change the way government budget allocation is happening for people in different buckets of society, different buckets of this social status. How much can one afford versus what is the treatment that person is wanting to have. Uh, Individual based healthcare data will definitely be beneficial. Doctors can take data driven decisions. Your insurance policies can actually be customized for every individual. Someone who's actually been very compliant on dosages prescribed by the doctor in early days of their treatment or evidence of an ailment should be paying much lesser premium than someone who's actually not been compliant to what has been prescribed. So I think incentives based on your performance is something that should be introduced as a part of the overall policy building or building the financial infrastructure on healthcare. I think that's what is missing today in India, and online platforms like all of us put together will actually be able to build those building blocks for this infrastructure. So definitely a big help for government as well.
Got it. So, Joy, with the significant increase in demand for medicines, coupled with the change in public behavior, such as panic buying over the counter painkillers in response to the lockdown, what are specific items that have seen such surge demand in your case?
See, as I said earlier, one was the chronic phase, which saw a lot of surge, and the acute. Uh, there wasn't a surge per se, but yeah, a slight fear psychosis, or anyone who was feeling that he was having a cough or a slight fever or something, they would just go and take immediate precautions, which they wouldn't do earlier. So other than that, there wasn't much of a surge. But then we'll have to find ways and means how we can capitalize on this momentum that we have gained on preference for online, whether it is B2C or B2B. And B2C would be relatively easier. B2B, the existing supply chains and the networks are still in place. So we would have to slightly improvise on a lot of our stuff and make it more efficient so that the retailer finally gets a better margin. And with that, we would also see sometime down the line that the retailers would have a more preferred option for online purchase from something like an Udan, because they wouldn't have to, they generally do it, the supply is generally short-term based. But then if we are able to do that delivery in the quickest possible time across the board, I think that's where we would have to improvise and do things.
All right, so I think anyone of you can answer, but maybe Gaurav, we can start with you. How are you people ensuring safety of your employees who are working even during the lockdown and delivering to the customers?
Yeah, this is actually very important, top priority for the company. There's a number of things that we are doing here. One is, of course, from an essential standpoint, we are ensuring that every employee that we have, he has, mask, he has gloves, there's access to sanitizer. All our retail partners, etc., facilities, they all have IR thermometers. They measure, they log everyone's vitals multiple times during the day. They keep records of that. So this is all table stakes. In addition, what we have done is that we've also set up what we are calling like a helpline. So it's a 24/7 helpline where any of our folks who, let's say, demonstrate any of the symptoms, they can call. There's a doctor on call 24/7. They can talk to the doctor. The doctor can basically take care of their case, and from that point on, it becomes something that is shepherded through the system without any hassles. So the employee is put at ease. His condition is sorted out. Now, it's also, there's also a constant risk that someone may get infected. So for all of our employees who are working on the front lines, there's also a loss of pay insurance that we have taken, where if someone is infected, then their treatment and their loss of pay for that duration is actually covered by insurance, and they don't have to worry about these things. There's also access to routine testing, etc., where we are making sure that our employees are the ones who are, for instance, first tested. We also maintain contact tracing for them to figure out. We've also done a lot of stuff around shift segregation and all to make sure that if in case something happens, then it's limited and it's minimized to the number of people. So across the board, a number of steps have been taken to ensure safety and well-being of the employees.
Is there anything which Dharmendra or Joy would want to add to this?
I think similar stuff as he mentioned. Try to ensure them with plans which can help them in case anything is infected. So, yeah.
Okay. So Dharmil, how do you think the healthcare industry in India will evolve after this? And besides telemedicine and online pharmacy marketplace, what do you think can be growing market in the healthcare in future?
I think these two itself. So overall, there are two parts to healthcare in India. I think IPD, OPD, and then there is this entire detection or ailment detection piece of how you are able to diagnose any disease. I think we are seeing signs of telemedicine, ramping up quite heavily. A lot of doctors are adopting to digital platforms and tele or video consultation. We are also seeing now a lot of innovative products coming in, which can help diagnose, any ailments at home. So, the, the the thing that is now moving at home is earlier it was services. We had medicines being delivered at home. We had diagnostics to be done at home. Now the consultations have started happening at home, and next thing that we are expecting to happen is diagnose at home. Use your mobile phone. Use different innovative tech products which can help measure your blood sugar levels, heartbeat rate, have an EMR done, check whether you have any of the diseases that are, requiring a blood test or something like that. So a lot of these have started coming up, and these things like there's a body patch which I think Abbott has, which constantly monitors your blood sugar levels or oxygen levels. I think these are things which will be adapted very soon. As soon as the doctors go remote, they will have the ability to monitor more patients, and for them to take data driven decisions. It'll be a must, it'll be very important for the body vitals to be remotely transmitted as well. So I think for that reason, I think diagnosis as a category will start moving online as well. This is something which has taken very nascent steps right now, but at least I believe that this will be the next big thing in the healthcare space.
Joy, you have operations across multiple sectors. So, what are your insights on the pharmacy sector vis-a-vis other sectors during this COVID crisis?
See, primarily we started with lack of manpower, lack of supply too, and the third was slight confusion in case of the chemist and all in certain areas where for the first week primarily, first 8-10 days, where it was like a totally a red zone where nothing was allowed, okay, which then they slowly opened up for saying only the essentials and the chemist shops would be, not even essentials, only the milk and the chemist shops would be open. So other than that, the manpower was an issue, which we did tackle efficiently, but within the available manpower resources that we got, right? And we did have to stretch a bit, but it did go to an extent that we had to sort of compensate the existing employees on the slightly higher side, and which is not a favor to them because they were also risking their lives and they were coming there. So it was more like an incentive. It is just like any other a person would have done, and he gets a higher bonus for achieving the targets. But here it was not target driven, it was primarily the payment was more. But then it was, as a nation, we had to get together to ensure that the well-being of every citizen, to the extent that we're catering, is taken care of.
Right, so I think I have one last question for all of you now. What are some of the best practices you would want our audience to know that you or your contemporaries are employing to mitigate global health risks?
See, primarily we have to ensure, every organization has to ensure that each and every employee, whatever function they may be doing, are taken care of in the most appropriate manner without primarily looking at a cost. We should not be cutting corners on ensuring the safety of our employees, because that is not only bad for the company, but it can also turn fatal, and it's overall the virus can spread from one to the other. So that is one thing that we should look at. And secondly, we should look at how to optimize on the existing resources in terms of finances that we have, because the market is going to be a bit tight. And for those companies who have raised money sometime just before that, they will have a slightly easier run, a longer runway. But yeah, we will have to work more efficiently and do a lot of saving and use the money in the right manner. Experimentation would have to be absolutely detail driven without wasting a penny.
Well, Gaurav, if you
I think
would want
the only thing that we've been telling everyone around is to take this seriously. We've seen people, taking this entire situation a bit lightly. The kind of approach that people will have to take is to take care of themselves, their family, their neighbors, and then that sort of percolates to everyone, your friends, your workplace employees, your colleagues, everyone. I think the more people be a little bit more conscious about social distancing and keeping the sanitization practices in place, I think we'll be in a better situation to tackle this. Till the time there's no cure, I think all the healthcare institutions would be overwhelmed with the cases and trying to cure the problem. So the only contribution that we can have is to take care of ourselves, and we shouldn't add on to the numbers that are already spiking.
Yeah, and I would just like to echo Dharma's thoughts. In fact, I saw this really fascinating meme the other day, which said how when the cases were low, the fear was very high, and now that the cases are high, the fear is very low. So I would actually like to remind everyone, if you look at our numbers, we are probably our number of cases are probably increasing by 3 to 5% every day. We go from 10,000 to 10,500 the next day, 11,000 the day after. And this is actually peak. I think we are just starting to see cases go up. There was a report, I think, yesterday where Mumbai itself has hit 50,000 cases. Maharashtra has hit like 90,000, 80,000 or something.
Correct.
So now is the time to stay home and stay safe. If you go out, you have to observe social distancing. Do not take it lightly, especially, your parents, all the elderly who may have comorbidities like diabetes, hypertension. They have to stay safe. I see it with my parents also. They think that now that the lockdown has opened, things are safe. They can have chai with their neighbors. No, none of that. None of that stuff is okay. Stay home. Do not go out. And it's a matter of another 4 weeks. And I think that if we can live these 4 weeks out in a safe fashion, I think we'll do just fine. So do your part, stay home, stay safe. And for everything else, we are here. We'll get you your medicines. I'm sure there's an Amazon Flipkart who'll get you other stuff, but stay home.
Yeah, thanks. I think people are so used to it that they don't realize it's still a threat to their health and to their family members.
Yep.
But thank you, everyone.
Thank you so
thank
much.
you, Dharmil. Gaurav. Thank you for joining.
Thanks. Thanks.
Thank you. Thank you.
Thank you. Bye.
For the